Hi, guys. It's Dr. Lily Johnston, board certified vascular surgeon, cardiometabolic specialist. And today I want to share with you some exciting news because we just did our first Detour procedure at Scripps Memorial Hospital where I work. And I thought we should talk about it because it is a pretty cool new technique that we have to help patients with peripheral arterial disease or blockage of the blood vessels in the leg. So let's talk a little bit about the patient because this is a pretty specific kind of procedure. It is called a percutaneous transvenous arterial bypass or PTAB, and the proprietary name is called Detour, but it is intended to treat blockage in the superficial femoral artery. So that's in the thigh, and we will end up creating this bypass sort of from the level of the groin down to behind the knee. Now, we have been able to do this for a long time with open surgical techniques, but sometimes that's not the best thing for our patient. This particular patient is somebody who is kind of ill. They have had an organ transplant, so they're on immunosuppressive medications or medicines that prevent rejection of their organ, but that also makes them a little bit more susceptible to an infection. And this patient also has obesity, which increases risk of infection. And finally, they have a very sick, failing heart, which means it isn't very safe to put them to sleep for hours and hours while we cut them open and have lots of blood loss and put a lot of stress on the heart for a big open bypass procedure. So, for all these reasons, we had a multidisciplinary conference where I spoke to the heart doctors and the kidney doctors and the internal medicine doctors, and we all assessed this patient to be very high risk for open surgery. And nevertheless, this person needed better blood flow to the leg because there was a bad infection there. If we didn't get better blood flow, that infection could cost them the leg, could cost them the life, could cost them that transplanted organ that's so precious. So we had to do something. Enter the detour procedure because this is completely endovascular or minimally invasive. We do it through a puncture in the artery and a puncture in the vein. And what we're able to do is to use the vein as kind of the separate highway. So you can think of the artery is open up to a point, and then there's this big traffic snarl construction, and it's blocked. And for her, this blockage was most of the length of her thigh. So it's pretty long. I tried once to go through with regular stents and wires and catheters and kind of do it the normal endovascular way, but it was just too calcified and too long. I could not get across that lesion. And there's maybe an option to try coming from the foot or coming from the other side, like the reverse direction of traffic. It would potentially be feasible, but again, that blockage was so long that I was afraid any stents that we put in from that direction would fail very quickly. The detour procedure is cool because it allows us to go from the open area of the artery up top where it's normal. Then we enter the vein, we go around that whole area that's narrowed or blocked, and then we re enter the artery below the blockage. We'll show you a picture. It's a little bit hard to visualize, but there's a nice schematic here. And you can see and then we put a stent through that whole pathway. So then blood is able to flow from the top through the stent. The stent travels in the vein that sits right next to that artery, and then it comes back out into the artery right around the knee. So it took us a little longer than it should ordinarily take to do the procedure because it was our first time and we were just getting used to all of the equipment. But ultimately, we had a really nice result for this patient. And we'll show some of the before and after pictures here too, so you can see that. But ultimately, she was able to get this procedure done. We had a great result. I think she's going to be able to resolve that infection that she has in her leg. And we didn't make a single big incision. We just have little band-aids on a poke hole in the vein and a poke hole in the artery. So this is new technology. It's been out for a few years now. The pivotal trial data have been presented and published, and it has great outcomes at 2 years. Some people will ask, what is the risk of a blood clot if you're going to, put the stent in the vein? Risk of a blood clot is about 4% at 3 years. And there were no instances of blood clots going to the lung or pulmonary embolism in the pivotal trial data. So very reassuring, seems to be a very safe procedure and has better durability than the other types of minimally invasive strategies. And for this patient who is so high risk for infection from an incision, now we don't really have that risk because if we were to have done an open bypass and she got an infection, that's not just like give her some pills and hope it goes away. That is sometimes more surgery. If the graft gets infected, then the graft goes down. We have to take it all out, even more surgery. The infection can become systemic and cause sepsis. And often that results in losing the bypass, sometimes losing a leg, or sometimes even more serious things like death, heart attack, stroke. So we don't take infection lightly when we're talking about surgical procedures for blood vessels. So avoiding an incision for her was a really, really big deal. And we'll see what her long-term results are. We don't know yet, but I was excited to be able to do this. One of my partners helped me, and we're really proud and excited to be able to offer this new technology. So let me know if that is interesting to you. If you want to hear more about that, we can do more content about the actual surgical treatment of arterial disease until I put myself out of business. And like this, subscribe, share it with somebody that you think would benefit from it, and let me know what you want to hear more about. Until next time, take really good care.